Good morning, folks. Good afternoon. Thank you for joining us. I'm Michelle Samara Tim. I'm with the National Environmental Health Association. We are glad that you were able to join us today for another one of the quarterly webinars from the NEHA Preparedness Committee. I'm going to turn you over to Sauda Yerabati, who is one of the co-chairs of our committee. Sauda, welcome. I'll turn it over to you.
Thank you, Michelle. Welcome again, everyone. Good afternoon. We are excited to bring you the second webinar in our series of preparedness talks from the Preparedness Committee. And we are going to be touching on all things environmental health related and as they relate to disaster preparedness, response, recovery, the full life cycle of disaster management. And today we are touching on some tools that are currently available for free for pretty much everyone to use. We'll be looking at some national and local level tools. And just to quickly reiterate that as a community, we span a whole range. We are inspectors, we are health educators, epidemiologists, researchers, policy people, and more. And we touch on so many aspects of health and safety. We make sure that during disasters and after disasters, people still have access to clean water and food, and they have clean air to breathe and so much more. So while all of this is happening, we are expanding our considerations of environmental justice to considerations of equity, what equity means in terms of social and other categories of equity. But how do we even know who our most vulnerable populations are? Where do they live? What are the multiple different issues that they're dealing with, and if they do happen to lie on the intersection of multiple different kinds of equity, then how do we prioritize resources to them so that they are not only taken care of during the disaster, but they can also recover more quickly? So this is just one of our conversations. Due to time restraints, we cannot cover every single tool, but be on the lookout. We will have more webinars coming this way. So we're going to start off today with a presentation on the Social Vulnerability Index. And the speaker is the coordinator for the Social Vulnerability Index, Elizabeth Pembleton from the CDC. Please take it away.
Wonderful, thank you. I will share my screen here in just a second. Let's see. Go. All right, can you all see my screen?
Yes.
All right, wonderful. Well, yes. Hi, everyone. My name is Elizabeth Pembleton, and I'm a geospatial epidemiologist and the lead for the Social Vulnerability Index here at CDC and ATSTR. And we're in the Geospatial Research Analysis and Services Program, which is a mouthful, so we go by GRASP. So I will start out with a little bit of history here. So what came to be known as SVI was created in accordance with the Pandemic and All Hazards Preparedness Act of 2006. And this act cited that public health preparedness and response capabilities were critical needs for the nation. So when this act was signed into law by the president, it was a mandate to which all federal agencies were tasked to comply. So CDC decided to build agency capacity in public health preparedness and response by addressing social vulnerability to disasters and public health emergencies. And from this group, there was a group of social scientists and statisticians in GRASP, and they began developing the SVI 15 years ago in 2007, and released the first iteration of the SVI in 2011. So it's been around for 10 years now. So, every single community in the US exhibits varying degrees of vulnerability to public health emergencies. However, a community's social vulnerability plays an important role in its response to and recovery from hazardous events such as disaster or disease outbreak. So social vulnerability refers to the demographic and socioeconomic factors that contribute to communities being more adversely affected by public health emergencies and other external hazards and stressors that cause disease and injury. So for instance, there are social factors like poverty that lead to certain populations being less able to prepare for, respond to, and recover from public health emergencies. And it's important to track and measure social vulnerability in order to address social disadvantage within communities and decrease human suffering, health disparities, and health inequities. So we developed the Social Vulnerability Index, or SVI, as an index, database, and mapping tool to assist public health practitioners with identifying and quantifying the most socially vulnerable communities in their jurisdictions. So for a bit more information about the SVI, so it's composed of Census Bureau data, and to get information for these 15 indicators that we have and these 4 themes here. So you can see the overall social vulnerability is a rank of 0 to 1, with 1 being the most socially vulnerable. And then we break it down into these 4 themes, which then have these 15 variables on the right. And it is important to remember that we do have information for the full US for census tracts and counties, and we do have databases for Puerto Rico and tribal tracts as well. And we have information. We started our first database was 2000 data. We have 2010 data, and then from there, starting with 2014, we do updates every 2 years. So we are coming up on our 2020 data update. All right, so moving on. So right here, you can see the 2018 map. And here, I think it's very important to see information on maps because it really provides some helpful context. And you can really easily distinguish areas of increased social vulnerability. So you can see the dark blue areas are the most vulnerable and the lighter areas are the least vulnerable. But one thing that makes the SVI a really helpful and unique tool is that it has this visual component, but it also has the database. So the database, which you can see behind the map here, has all of the information that goes into the SVI, as well as the final SVI rankings. And again, we provide this for each tract and county in the US, and we do this, this is freely available and, hopefully very easily accessible tool. So another thing that we have, we also provide these prepared county maps for every US county. And these display the social vulnerability at the census tract level for certain counties of interest. So we have found that our partners have said that these are very helpful because it's an easy way to take a quick glance and get a pretty good idea of the varying patterns of social vulnerability in these specific jurisdictions. So in this example, this is DeKalb County in Atlanta, Georgia. And you can see, in this bottom left-hand corner of DeKalb County, there's pretty low social vulnerability for, the socioeconomic status and for household composition and even for housing type. But we can see that the race and ethnicity and language component of the SVI is really high. So you can see what makes up this overall social vulnerability in these prepared county maps. Lastly, just about the utility of the tool, SVI has been used by several federal, state, local academic partners for a variety of purposes. And as an example, our tool has been used to help with understanding the association between social vulnerability and physical hazards like hurricanes and tornadoes, or planning hazard mitigation and public health funding allocation, and these are more traditional uses of the SVI. And it was also covered in the CDC Planning for an Emergency, which is shown here. This guidance document, and this guide functions as an aid to emergency managers as it describes the intersection of our population-based CDC SVI tool with the local knowledge of individuals and communities provided by local public health workers. But more recently, we have found that SVI has utility for infectious disease outbreaks, such as with COVID-19, and we've also seen SVI expanded and used to better understand chronic diseases like obesity, injury, cancer, and physical inactivity. So although it was started as a, very much focused on disaster, it's been used for quite a few different potentials. So this is an example of how SVI has been used regarding disasters. And this is an early study regarding Hurricane Katrina and SVI. And so, literature tells us that socially vulnerable populations are more likely to be negatively affected by disasters and less likely to recover quickly. And this slide portrays maps from our first study after creating the SVI, again, with this, original intention of disaster preparedness and response. And this was testing this theory to informally validate whether SVI was measuring what we expected. So on the left, we mapped and compared Hurricane Katrina related drowning deaths by census tract to SVI rankings for elderly populations. And we found that almost half of Katrina fatalities were over the age 75. And given that only 6% of the pre-Katrina residents in the affected area were older than age 75, the elderly were especially vulnerable to this catastrophic event. And the tracts with the red hatching show where the number of deaths per tract is significantly higher than expected compared to a regional mortality rate. And of the 15 tracts with a statistically significant higher number of deaths than expected, 8 are located within the most vulnerable category in terms of elderly residents. There's one exception, one tract in the lowest SVI value category, but the remaining tracts are in the middle SVI category. And then in addition, on the map on the right shows the change in mail delivery before and after Hurricane Katrina as an indicator of recovery. And as would be expected, the heavily damaged areas have been slow to recover no matter the neighborhood characteristics. But areas that have socioeconomically vulnerable populations are also slow to recover even without heavy flood damage. So areas that experienced heavy flood damage and have socioeconomically vulnerable populations are the slowest to recover. So this was, a really helpful way to examine both the SVI data and, validating what we were seeing. So, as a quick summary, as a recap, our SVI tool measures 15 socio-demographic factors to identify socially vulnerable communities across the US, and measures social vulnerability for all US census tracts and counties on a scale of 0 to 1, again, with 1 being the most vulnerable. And our tool is useful for assisting communities in need during public health crises and disaster events, really whatever they might be. So, along with different types of use cases of SVI, there are many different types of partners working with our data. And this is certainly not an exhaustive list, but we've just noted a few different federal, state, local, and academic entities using our SVI data, just to provide an example. And I want to check, how are we doing on time? Do we have time to do a demo, or should I wait until maybe later? if there is additional time.
How long do you need? Elizabeth?
Maybe like 5 to 10 minutes.
I think we should be fine.
Okay, and I can probably do it a little bit quicker than that. So
Yeah. Say 5 minutes. If you can do that, that'd be perfect.
okay. Are you all still seeing my screen, or is it just the slides?
Slide. Well, I can just see a slide right now.
Okay, then hold on one second. Let me pull up the, okay. So, oh, and actually, sorry, hold on one second. Let me see, we'll start here. So this is, I think, one of the most helpful places of the SVI website. And this is our data and documentation. And I'm a little bit of a data nerd, so this is my favorite page. So I like to start here. But this is where you can get all of the information from the SVI. So we have all of our different years that you can choose from. You can choose the full United States. You can look at Puerto Rico, and just to note that Puerto Rico is not ranked against all the other states in the US. It's its own separate database. But then each of these, each state in the US as well. We have census tracts and counties, and then if you want to see it as a shapefile or a CSV file. So this is, I think, one of the most helpful tools. And then additionally, the documentation, which is incredibly helpful to look through. It's a lot of information in here, but it has all of the different calculations for each variable, where it was pulled from, how each individual piece was calculated, and how it fits into the overall SVI. So I guess some other pieces that are pretty helpful, and I know I am going through this really quickly, but we have a fact sheet, which is also helpful to get some really quick information. Again, SVI at a glance, another place for some really helpful information here, and different uses of it. And then we have an interactive map, and I can show this to you, but just note that this is going to be updated very, very soon. We're working on putting out the 2020 data and the along with an updated interactive map. So it is possible to get all of this information here, and you can see a lot of different information here. You can click through it, but again, we are going to have a new interactive map that is hopefully a bit more intuitive coming up very soon. But lastly, these two pages here, the publications and materials, this is how others have used SVI. So we have training videos, but then we also have like the original publications of SVI to really dive in a bit more with the SVI specifically, but then how different people have used the SVI for different purposes. So these are really helpful. And then, of course, the FAQs are helpful as well, I think. So I know this was incredibly quick, but that is a pretty high level and quick and dirty example of SVI and how it can be used. And yeah, I'll stop there.
Thank you, Elizabeth. And just so everyone knows, please hold your questions till the end. We will have a Q&A session. So we will move to our next speaker. It will be Charlene Contreras from LA County Public Health, Environmental Health, and she will speak on the Healthy Places Index. Charlene, are you ready to share your screen? Okay, yeah, we see it.
Are you seeing? Okay, just want to make sure you see my screen. Today, I'm going to talk to you a little bit about how we are using Healthy Place Index, the Healthy Places Index, and also a little bit of CalEnviroScreen for our environmental justice work. that we are taking on here at Environmental Health. And the environmental justice work actually coincides with our emergency response work when there are emergencies or disasters. Now let's see if I can get my screen. There we go. Okay, so right here, I just wanted to kind of go over some of the definitions of equity that we have at the federal level, and even in, you know, the state. There are these clear definitions of equity and what environmental justice is, that helps to guide our work. And then when a disaster or significant incident does occur, these environmental health disparities, you know, they're often magnified, and they rise very quickly during an emergency. And so as we look at some of these definitions, you know, that environmental response agencies offer, they're emphasizing, you know, fairness, all people, regardless of race, and they're all great concepts. The challenge, though, is in successfully addressing, you know, to successfully address the equity, that rests in how you implement it. And that's where the challenge comes for environmental health or state agencies that are responding to any kind of disasters or emergencies. It's that implementation. And so most of you, many of you probably have already seen this picture or some kind of version like it. And so the issues that we have with the definitions that are provided by the federal and state agencies is that, you know, each community has different needs, right? Different baseline burdens, different baseline opportunities, and their environmental conditions differ and their socioeconomic conditions differ. And so if we look and, you know, treat everybody fairly and everybody the same, we have sort of this equality concept on the left side, where those that really need help while they're receiving, you know, assistance, it might not be meeting all of their needs. And so when we look at equity and the approach that we take from environmental health and local agencies, we want to prioritize any of the resources, and we want to prioritize them for those most in need. And in order to do that, we need to figure out, you know, who are those most in need and what those needs are. And so the two tools we like to use, we love both of them, but they do different things. And so the two tools we use, the Healthy Places Index and the CalEnviro Screen, we always recommend using both tools because they do present data and place-based information in slightly different perspectives. Both do advance health equity, but in different ways. The good part, fortunately, both of the tools are available at a census tract level, so they can be overlaid. You can look in Healthy Place Indexes and the Healthy Places Index and find some information based on census tracts, and then the CalEnviro Screen can lay right over. So that is very beautiful. That usually never happens, but in all their brilliance, they made these have a common denominator at the census tract, and then we're able also to cross-reference some of the data because they do share some data sources, but not many. So if we look at, you know, CalEnviro Screen, that was launched earlier in 2013, and then Healthy Places Index in around 2018, but the Healthy Places Index really emphasizes social conditions. So it maps 15 of the 25 indicators, for example, are social conditions. So it really gives you a good idea of what people are experiencing in those census tracts and in those areas. The CalEnviro Screen has an emphasis on environmental pollution and exposure. So 13 of their 21 indicators are really emphasizing environmental pollution. So you would see, you know, a different factor because they're weighing the data differently. The one thing we do like about Healthy Places Index is that it does provide this extensive policy action guide, which is phenomenal. They went above and beyond on this policy because what they really were trying to do is link the data that they have to policy decisions and policy changes. At Cal EnviroScreen, it's a different goal. They're really mapping this cumulative pollution. And they're looking at how burdened a population is, really targeting, they're really targeting the pollution sources. And so you really don't get an idea of what people are experiencing, but you do get an idea of what they're exposed to. And so that's how the two, kind of connect, and why we like to use both of them. The only confusing part, I would say, is the way they score. So in Healthy Places Index, the high score is a healthier community, lower score is unhealthy community. At Cal EnviroScreen, it's a little bit opposite. It's actually exactly opposite. Those with a high score have a much higher pollution burden. And those with a low score don't really have, they're not exposed to too much pollution. And so those are why, those two tools are what we love to use. And I'll show you something. The top in the blue, this is another key difference, Healthy Places Index. The unhealthy areas are dark blue, and the healthy areas are green. And with Cal EnviroScreen, the healthy areas are green, so we have common denominator there, both green, but the unhealthy places are in red. And so if you look at these two, for the most part, they're similar. You'll see dark red and dark blue in the same places. Because it's so the tools correlate very, very well. And then you can go into each census tract and really look at, what is going on using both sets of tools. But we like, these types of maps that are just giving you this bird's eye view of where the differences and disparities are located. And then during emergencies, we all know where to target our resources for the most part. One of the things we did too is we did a Los Angeles County ranking project where we took the Cal EnviroScreen data, and they were put together in quartiles using this spatial joining and averaging of the scores of census tracts. And what we were trying to do was, the census tract information in LA County, there's 22, maybe almost 2,300 census tracts that account for 326 cities and communities. So we aggregated the census tracts into what our cities and communities are, and we then ranked our county. And so we did the same thing for Healthy Places Index. I just didn't have any good pictures that I could show you, but the labeling represents our the ranking of our cities. And we have, the worst polluted city ranking #1, and then all the way to 326, which is the best CES scores. And so what that helped us to do is that we labeled all of our cities as green, dark green, light green, orange, and red. And we were able to just kind of take a look at our red communities and then target some hazard assessments there, target our mitigation efforts to those that are really in need, because we do not have enough resources here at Environmental Health and our Public Health Department, to reach out to everyone equally. And so, we made a listing where we ranked our communities from 1 to 20, or we took the top 20 red communities, which were the most polluted, and we made a conscious effort to just focus our hazard assessments, focus our outreach, our outreach events and outreach work into these communities. Now we continue to provide technical support to other communities that are ranked, 21 all the way to 326. However, the support does look different from the communities that we ranked in 1 through 20. We kind of, those communities that are in the really dark green, we give them a lot of self-help, and we call it self-help. Here's the website, here's some of the resources we have online, let us know if you have any other questions. But those communities that are in the red areas, We actually physically go into those communities. We convene community meetings. We convene regulators around some of the pollution issues, and then some of our other agencies around the social issues to kind of get them the support and the resources that they need. And it really helps, the community, because they get a different kind of treatment. Again, the 2 boxes all the way on the right, they get different treatment. And I like to return to this slide to emphasize, that certain communities are highly burdened. They are, socially disadvantaged, and the disasters, as these disasters continue to rise and incidents continue to get bigger and bigger, through climate change, through our aging infrastructure, all of the many reasons why disasters will continue to come and impact some of the vulnerable populations more than others. We need to be cognizant and really put a lot of our government efforts into those communities that need it the most. And we always feel like other communities that are thriving, yay, you continue to thrive, you're doing a great job. And those that are not thriving, during an emergency, they will suffer far worse. And so we like to use these digital tools. I think that was it. Yeah, we like to use these digital tools to help make, number one, informed decisions about our resources, but also to, they're a great communication tool to other agencies and other partners. And so other county agencies, response agencies, even planning departments, they rely on our data and the way we frame the work coming off of the Healthy Place Index and the Cal Virus Screen. They really appreciate the public health perspective and the way we explain the data there. That's all I had. I hope I didn't go too fast. Soda, we're waiting for questions, right?
Yeah, and
Okay.
Thank you so much, Charlene. Both Elizabeth and Charlene, you did a really great job of outlining how public health and environmental health can use these tools for planning all the way through response and recovery. As we know, environmental health touches on all the basics that keep us as individuals alive, but also communities functioning in a healthy, well way, because let's face it, the well-being of our communities is integral in to how we feel about ourselves and how we can hope for the future. And so for communities that are impacted by disaster, to give them a way forward to rebuilding and reoccupancy, and environmental health is there the whole way. And these tools are just one way that we can use how to help the communities get back on their feet again. And now we're going to shift topic to the probably the biggest issue, existential crisis that we face today of climate change. And you'll be hearing from Osamu Kumasaka from California Department of Public Health, Office of Health Equity. Take it away, Osamu.
Hello, thank you for having me today. My name is Osamu. I use he, him pronouns, and I serve as the Tribal Climate Specialist in the California Department of Public Health's Office of Health Equity. I'm speaking to you today from Huichin territory, which is the ancestral and unceded land of the Chochenyo-speaking Ohlone people. Our team in the Department of Public Health, the Climate Change and Health Equity section, or CHESS as we call it, is a small but mighty team of 8 staff. And we focus on upstream policies, systems, and environmental change to assure that California's actions to prevent and prepare for climate change improve health equity. Today's presentation will involve me giving a high-level overview of our approach and activities, along with an overview of our Chivies tool, which is an interactive data visualization platform. So this tool is is online, and it is a visualization and mapping platform we've developed for climate change and health vulnerability indicators we've selected for California. These are indicators, maps, and other information that can be used to help identify the populations and locations in California that are most vulnerable to the health impacts of climate change. First, I'm going to give a little bit of background about our office and how these indicators were developed, and then I'll do a short demo of the tool, and then just tell you a little bit more about how the tool has been used in our lessons learned. I want to start with just a short overview of our team for some context. So we work across agencies and departments to assure that what California does to prevent and prepare for climate change also improves health and increases equity. We provide consultation to state agencies implementing California's climate change policies and plans across areas like energy, transportation, land use, forestry, emergency preparedness, labor and workforce, and much more. We also provide technical assistance and tools to tribes and local health departments to increase their capacity to address the human health impacts of climate change. Here's just a little bit of history on these climate change and health vulnerability indicators. Our program is part of a CDC-funded initiative called Building Resilience Against Climate Effects, or BRACE. So our California BRACE, CalBRACE project provides resources and technical assistance for state and local health departments to build climate adaptation planning capacity, and enhance resilience. We do that through various activities. You can see an example of our online adaptation toolkit at the bottom right here. But one of the main tools is providing data for assessing climate and health vulnerability. Back when the program started, this was done by gathering various types of available data and getting stakeholder input on those products. But we created climate change and health profile reports for each of California's 58 counties. And these reports include information on what climate change is, what the climate change projections are for the county, including temperature, wildfire risk areas, and sea level rise, an overview of climate change and its impact on health, descriptions of which populations are most vulnerable, and data on relevant health outcomes in the county, such as the prevalence of asthma. In addition to those reports, our staff developed a suite of indicators to be used at the local level for assessing climate and health vulnerability. These are the chivies that I've already mentioned. The indicators are grouped into 3 types that you can see here: exposure indicators, adaptive capacity indicators, and population sensitivity indicators. All of this data is available at the local level. And for the first few years, we provided this data on our website in downloadable Excel spreadsheets with documentation and info on the relevance of the indicator to health and climate change. But more recently, we translated them into a more user-friendly interactive platform where users can get maps and download the data behind the maps to create and aid in their own local vulnerability assessments. So I'm going to just demo the tool now. And if you want to follow along, you can go to this link, which I can paste into the chat. One second. Okay, there's the link, and here the platform. So I'll just note, there are many data tools, but for looking at climate data in California, but I'll note that the Asian Pacific Environmental Network assessed a variety of those tools, and these chivies were selected as one of the 4 best for scope and quality, along with Healthy Places Index, which was just demoed by Charlene. So you can start by choosing a county on the map. Here we've selected Lake County. And then you can go, this just gives a little bit of tutorial on how to use the website. Then you can go to a county snapshot to see how your county compares to the state averages. Indicators that are higher than the state average will be at the top. So you can see here, Lake County has very high wildfire risk as compared to the rest of the county. And ones that are lower will be at the bottom. Has a greater proportion of English speakers in this county. You can then switch over to this tab, which has single indicators on it. So selecting up above, we have our whole list of indicators. I have shown here % of population currently living in very high wildfire risk areas in Lake County. So you can see some variation across the county. And then finally, you can check out this vulnerability tab, which I love. I think it's really interesting. It shows where counties sit when you choose 2 indicators. So you can choose an exposure, an environmental exposure indicator, and sensitivity, a population sensitivity indicator, and see where a county sits relative to other counties in California. So for example, this is showing vulnerability based on both projected extreme heat days on the x-axis and population over 65 on the y-axis. Orange counties down here have lower vulnerability on both factors, and up here, darker purple counties have high vulnerability on both factors. Yeah, and so you can just use these drop-down menus to select what you're interested in. Just to conclude, this tool is built using R Shiny, and it's a living resource that we have plans for to make improvements and expand the data provided. We'd like to add health outcomes data as well as more data on exposures such as wildfire smoke. And it has been well received by stakeholders in the state. It has been used for local and tribal vulnerability assessments. It has been added to state climate change grant guidelines as a suggested resource that applicants can use to assess and demonstrate vulnerability. It has been used in other statewide plans and policies, such as helping in defining the most vulnerable populations to wildfire in one of the state's wildfire reports. And chivies have also been added to other data platforms, including Healthy Places Index and the Environmental Public Health Tracking Network's data platform. Just a couple lessons learned. We found that R Shiny was flexible and worked well for our staff. We didn't need an outside web developer, but we still have a lack of staff and time to make all the changes we'd like to make. Our epidemiologist, Meredith Millette, has done a huge amount of work on it. Also, the data gets out of date very quickly and needs to be updated often. So we need to balance updates with wanting to make additional features available. And then data for some areas and populations are difficult to find, such as for tribes and rural areas. Thank you so much.
Thank you, Samu. That was very informative. It feels like there's a lot to learn. Okay, before I get too carried away with the questions I want to ask, I would like to open it up to everyone joining us here today. And so Michelle and I are here, and what we recommend is you can either post your question in the chat box, or if you're joining us by video, by Zoom video, you can always raise your hand and we will call on you. Okay, while we're waiting for people to start typing their questions. Oh, it looks like, okay, I don't see any yet. So if you don't mind, I would like to go ahead and ask a question, and this is to all speakers. Clearly, this is all these tools are pretty sophisticated. What would a local jurisdiction need in terms of resources to be able to utilize these tools? And I'm thinking, do they need ArcGIS? What kind of staffing and resources would they need? Do they need experts?
Yeah, hey, I'll jump in first. So it depends on what they're hoping to do, but we have a couple of different ways that people can access this information, and we do try to make this as easily consumable as possible. So as I showed, we do have this interactive website, so people can go directly to this website and get, explore and get information there. We do also have the data downloadable, again, as shape files or as CSVs. So if visualizing it is not necessarily what you want to do, but if you want to do something else with that, or do some analyses, that could be an easy way to do that. But really, it just depends on what you're hoping to do with that. But really, no special software is necessary.
That's good to know. Thank you. And Samu, Charlene, anything to add to that?
I would agree. I think it would depend on what exactly local health department or local government, tribal government wanted to do with the data, but it is downloadable as a CSV. And so if you have some GIS staff or expertise, it's pretty easy to join that to a spatial layer and make your own maps. But we have, tried to create a platform that, at the most rudimentary, you could screenshot or include some visuals from in your local climate adaptation plan or hazard mitigation plan. I loved seeing how Charlene and the team at LA County has used the HPI to do their own analysis. I think that is maybe a more sophisticated step you could take, but it was, I think, very inspirational to see how you've looked across the different cities. And I think you could do a similar thing with the census tract level data that's available in the Chivies tool.
Yeah, and I would add, there's something for everyone there, right? With the Healthy Places Index and a lot of the Kellen virus screen, you can be a super techie and know GIS in and out and write computer software and utilize that information, or you can be like, some of our staff, and we just like to dabble in stuff, but we do screenshots. The glory of the Healthy Places Index and the Kellen virus screen is they generate the maps for you, so that you don't really need a GIS person. If you don't have one, you can, work with what there comes out of the box, so to speak, and make your maps on your own. You can also download Excel files, download the Excel data and have epidemiologists work on it if you have those available to you, or manipulate the data yourself, through an Excel file. Or you can download the shape files and then create your own maps as well. So there's a little bit for everyone, at every level, just depending on what you're trying to achieve. And I think that is why these digital tools, I think, are so important, because sometimes, small local health departments, we don't have those kind of resources, or there's only one GIS for the whole entire county or something. And to be able to manipulate the data and kind of make these maps is not always easy. So I think that's the benefit of these tools that are ready and available.
Absolutely, thank you. And as you pointed out before, you can then take it to your partner agencies or entities and work with them collaboratively to address those issues. Okay, so I do see a question here in the Q&A. With the Kellen virus screen and Chivies tools, are these tools functional for places outside of California? If not, is expansion planned? or are there similar interactive databases for other states?
I think, go ahead. I don't know if you know more, but I think they're limited to California.
They are, yeah. I think this is a good question for your state agencies, most likely, although Elizabeth, I don't know if you have some sense of if there's other climate focused tools that are available at the national level for other states.
You know, I'm not entirely sure. I know EJ Screen is something that is possible, but that, you know, that's more justice focused. So yeah, I'm not entirely sure of other national options.
Any other questions? So, so on the topic of environmental justice, I would like to ask a question as people are thinking, again, with the new Biden executive order and also funding that is streaming down to work on health equity issues and infrastructure building, where agencies are being encouraged to really consider these issues. Any thoughts or comments on those?
Sure, I can jump in there. Sauda, so here at LA County, we are really looking at a lot of that infrastructure money to come in and invest in neighborhoods that have historically not been invested in. And so, you know, the long story of environmental justice and where it started was, you know, not lack of investment in certain neighborhoods. And, you know, there was not a lot of tree planting, there was not a lot of parks, not a lot of supportive infrastructure in those areas, you know, that when the communities were being built last century ago. And so utilizing the infrastructure money and investing in targeted areas that don't have trees, for instance, that's some of the areas where we are working with our public works department, as that department is charged with redoing and maintenance of roadways, maintenance of sidewalks. And so we're working to inform them, you know, where they can to install cool pavement that would allow people to walk around. We're giving them some clues on trees. We had a big tree committee. And so it was a pretty long process to find some of the trees that, you know, were shade. They provided shade, that were drought tolerant, and that didn't go into the roots didn't go into the into the sewer system. So everybody, it was a nice collaborative where everybody really talked about their perfect tree, and we came up, and if anybody needs it, with like about 25 trees that meet the needs of each department. And so now that we have that listing, the Department of Public Works, we're like, go forward with planting any of those trees in this area. And so we're able to, I think that the Healthy Places Index has a tree canopy layer. And they let them, and so we print it out for them and we show them, oh, you're going to be working in this community. Well, here's where they do not have enough tree canopies. We gave you the list of trees, go get them. And we also support and write, you know, for their grants as they're applying for that funding from the federal and state governments. We write supportive letters and we give them all the data that they need to be successful in getting those grants. So it's a win-win for everyone when we all work together.
Yeah, one more, a few excellent examples, very specific examples, and how important that is for infrastructure building, because that's where it all starts. You build resiliency. It does seem like the water infrastructure funding, for instance, which is $43 billion for the whole state. And as we know, EPA or ESF 10 will be in charge of managing that, but local communities will be the decision makers. And as we know, it is, again, tribal communities and other marginalized communities that really do need that infrastructure in place, both drinking water and wastewater infrastructure. Not to mention so much that we can do for climate change, and trees are an excellent example. So anyone have any other comments or questions? There's a lot of things coming through in the chat, of course, that I think you can see. So any other questions? I'm scrolling through to see, okay. Can the panelists provide any information on any local health department that has used these tools? But I think you kind of addressed that already.
Yeah, I can, again, on the publications page, we have a lot of different examples, but one that comes to mind is working with the Massachusetts Department of Public Health. Well, that one was more focused on COVID. But yeah, we have seen quite a few different local and state health departments using SVI in really a variety of different ways. So yeah, if there are any specific questions, I can certainly point you to some people who would have additional information for whatever specific topic you might be interested in.
Excellent. Yeah, I do believe so. We have your contact information. And of course, people are asking if the link will be available. So there's one for PowerPoints. Will the PowerPoints be available? And then there's someone else asking, can you please share the tree list link as well?
I also just wanted to share that we have some great examples of local climate action plans and other kinds of plans that have used the indicators that we selected in our CalBrace toolkit. So I'll share the link to that, and you can just click to the adaptation plan and action tab to see some examples linked in Contra Costa County and LA County, Santa Clara.
Excellent, thank you. Okay, so we're close to the top of the hour. Anyone, any further questions, comments? If not, I think we're pretty much done, and we will get back to you. Michelle, could you comment on the link? Will it be accessible?
NEHA will make sure that this information is available on our website. So NEHA, www.neha.org. Give us a few days in order to be able to get it together and put it up. We'll include the links from our speakers. We are so happy for the participation of the NEHA Preparedness Committee and their work, and to our panelists as well. Anyone that needs more information on that, again, our website, www.neha.org, wealth of information there. We thank you for all the good work that each and every one of you are doing on your local levels, because environmental health is profoundly local, and you are the superheroes of environmental health. So thank you all. Thank you, Sada. Thank you, panelists. And we wish you all an absolutely wonderful afternoon.